evening, everyone, and welcome to another episode of Our Point of View Talk Show. We are so glad that everyone is able to join us tonight. And we're especially excited because we're talking about coronavirus update. So we're going to go ahead and introduce our host and then get to our special guests. So first, we want to say hello to retired Captain Jackson. How are you, Eric?
Hey, what's happening? Enjoying retired life.
Good. Then we have Miss Connie Abraham. How are you, Miss Connie?
Hi, everybody. Hey, OPOV family.
Hey, Miss E.
Hey.
And next we have Jennifer, and it's Christmas wherever she is.
Listen, once Halloween is over with, it's fair game. You hear me? You hear me? Hey, y'all. Good to see you.
And it's a beautiful Christmas tree. I love it. Looks gorgeous.
Thank you. Thank you very much. Thank you. A lot of work into that tree. Hey, Dr. K. Hey, Miss
And our special guest, all the way from Washington, D.C., is Nurse Meedy Bordenelli. How are you?
Hey, good to see you guys. Thank you for having me
Hey.
again, Jackie, and hello to our OPOV family. I'm glad to be back.
Great. And all the way from Atlanta.
Atlanta.
That's now open. We're in the
How are you
green.
doing, Dr. K?
I'm doing great. Hi,
Good.
So as I first mentioned, we are going to be doing an update, as we do always, on the coronavirus. So we can find out what new things are happening, what new concerns everyone are having, and if we're on track the way the government wants us to be. So how about you, Nurse Meedy? Why don't you start with us? Give us just a little update of what's going on in the hospitals.
So, hey, everyone. Again, thank you so much for allowing me to share this platform with you, Jackie, and Captain Jackson, and everyone, my esteemed panelists tonight. So I always put the disclaimer, if you know me personally, I am not speaking as representative for the organization upon which I work. However, I do serve as the chair of the Board of Nursing here in DC that represents nearly 29,000 nurses and other healthcare individuals that are licensed to practice in the District of Columbia. And the short answer to your question, Jackie, is that our numbers here in the DC proper, and I want to make sure I'm very clear about that, because Dr. K and I both went to the illustrious Howard University, the Mecca, the hilltop, absolutely. And so people also say the DMV, meaning DC, Maryland, and Virginia. And so the stats that we have here in the District of Columbia specifically are actually pretty good. The rate of community transmission has significantly decreased. We still continue to have mask mandates, particularly in indoor settings. And the ability to gather with more than a certain number of people per the square footage of your facility is also still in place. And so even though some things are a little bit lax comparative to this time last year, we still have multiple vaccination clinics that are happening throughout the district. We also have a major, children's medical, most people have children's hospital centers throughout the country. And so in DC, we have National Children's Medical Center. So I'm sure Dr. K and I will briefly talk about that, where just last week, Pfizer has now allowed 5-year-olds and older to now get vaccinated. And so that is a big push here in the district, specifically as it relates to in the actual hospital settings. The numbers are very small, quite frankly, in comparative to where we were last year again. Big however does not mean that we don't have patients. My facility is a little over 900 beds. We average an average daily census of about 700 to 60 people. And I believe last count, we were still somewhere around 20 to 30 people that were active COVID positive patients. And yes, a few of those are, in the ICU, one or, a few of those on the ventilators, comparative to last year when we had almost 200 people. So obviously significant decrease. So, DC is a very liberal city. Obviously, we're the seat of the nation's capital. And so goes DC, tends to go the most rest of the country, at least here in the surrounding areas. And so, yeah, we're doing pretty good. I know we're going to talk about COVID, but what I want to share, Jackie, in my closing opening statement, if you will, is that what I'm really disheartening to hear and to have to share with you all, again, Dr. K and I will, I'm sure, talk about that briefly, is we're seeing a high number of patients of cancers, heart attacks, kidney disease, things that have gone undiagnosed and or underdiagnosed because of the last 20 months. And so the hospital is crazy full. The ERs are overrunning right now. There is a significant nursing shortage. Actually, the president of the ANA, the American Nursing Association, which is our national body, if you will, for nurses in the United States, actually wrote a statement and an address to the Secretary of the Department of Health and Human Services, indicating that we are in a crisis mode for nurses right now. Again, I want to be clear, not necessarily in the DC area specifically because of COVID, but as a subsidiary of what's been going on in the middle of this pandemic. And so right now, the cancers are off the chart, the heart attacks are off the chart, the orthopedic, arthritis issues that haven't been addressed, the diabetics that have not continued to make sure that they were okay. So you're having more people having those flare-ups, more people with dialysis issues because kidney issues being under and not diagnosed. And so that's kind of where we were. And I think, Jackie, if I probably go back to I've been on your show a few times now, we talked about the unexpected impact of this pandemic, and that's kind of where we are. So long opening, but COVID per se, the actual disease itself, we're doing pretty good, but there is a lot of impact from COVID. So that's where we are right now.
Okay. And Dr. K.
Oh, yes. Losing my power here. Same thing. We're seeing decreased numbers of cases, especially here in Georgia. The mayor has declared Metro Atlanta to be in the green zone, which means like no mask are required, which scares me a lot. Only because Fulton County Health Department actually won a grant from NIH to send out at-home testing kits to certain zip codes. And so people are testing at home, they're not reporting. So we have to think about that. And just testing overall has declined. So I think that, and then too, when I looked at the pictures for the Braves Parade, so we already know what's going to happen after that. And being that people are already making plans for indoor holiday dinners, and just because it's cold and people are migrating inside now. So I think we have like a false sense of security, and it is flu season as well. And so there's just where we saw very few flu numbers last year because everybody was masked up and everybody, was like kind of social distancing and all of that. And so now the opposite is happening. Mm-hmm. And we're starting to see like a high number of flu cases along with pneumonia. And so we don't know if the pneumonia is actually caused from COVID or flu, because there are a lot of patients that are presenting with both, well, all three rather. So yeah, it's still cases in the North and the Midwest have increased overall. The South, I don't know if that we're just not reporting or what the issues are, people just staying home and tending to themselves, but just based on the statistics and what I've seen and just how analytics go, like we're not where we think we are. So I'll just leave that there. And I'm sure that media and I will touch on a lot of these things because it's just a lot of false securities and still some misinformation going on. So That's all we
Now,
got.
are they still even offering the flu shots?
Mhm.
They
Yep.
are?
Absolutely. Absolutely. I 3 weeks ago, I think it's been now, I did my flu shot and my COVID booster on the same day. And so strongly encourage people to make sure you do both. To make sure that gets done as soon as you possibly can. To Dr. K's point, we are definitely in the throes of the flu season, and the flu season continues, at least here in our area. We call the flu season per the CDC up until March 31st. So you can start getting your flu shot as I think it was like the middle of September. I forgot the actual date, up until March 31st, where you can get the flu shot.
Okay. Now let's talk a little bit about the children 5 and up who are able, the children who 5 years old who are able to get the flu shot, the vaccination. Yeah, the vaccination.
I'm so glad you brought that up because that was the number one thing I had written. The
Oh,
children.
I'm going to ask you, why were you shaking your head? She's shaking her head.
Of course.
I'm definitely going. Connie,
Of
what
course,
you got to
the
say?
children.
Oh,
Now,
God.
how is that? How is that the rollout for the 5 to 11 shot? How is that going? And the vaccine that they're getting, is it the same that the adults received? Is it diluted? Is it half? Or
So it's 1/3 of the dose of the adult vaccine, but they still have to get 2 doses.
Okay. And when they get it, do they get theirs like in 4
Yes,
weeks? Or do they
21
get theirs
days later.
21
Same,
days,
it's the
same
same.
way?
Mhm.
Okay. Okay. And the parents are okay with this?
Well, I would say that again, I think when you think about no different than we were with when the public was able to get vaccinated, it's pretty much the same thing, because obviously if you have any vaccine hesitancy and or you are anti-vaccination, probably so goes your children because they don't have a choice, right? But I know again, here in the DC area, it's most kids are getting it. Have personal friends. My son, he's 15, so he had already gotten his because I got Pfizer, he had Pfizer, my husband got Moderna. And so he too will be getting his booster shot when he's eligible after the 6-month time frame. But here in the DC, the rollout is pretty much the same. The mayor, the infamous Mayor Muriel Bowser, shout out Black Lives Matter Plaza. She has pretty much did the same thing. Some of the local communities, community centers, the same thing as relates to some of the schools. Some of the public schools, they have had vaccination clinics as well. There's a specific, DC Health on all the social media portals, the dates, the times, all that can be done. Also, I do know a lot of the pediatrician offices, as well as Children's Medical Center, which again is one of the place pretty much where you take your child here in the DC area for any pediatric care. They also have it. So there hasn't been a backlog. There hasn't been, people waiting to get appointments. It's not like that. It's a pretty easily accessible thing to Dr. K's point earlier with having 1/3 of the dose. So at least here, the general consensus is most children are getting it.
Well, I think that one of the, if I may say so, it's another reason why the numbers aren't soaring with children 5 and between that, starting at 5, is because parents are not, I know parents who have been vaccinated but will not vaccinate their children because they're 5 years old. My thing is that, and I've been doing a lot of studying and reading myself, but a child has to build their immune system just like an adult has to build their immune system. If I give my child a booster at 5, then how is he building his immune system at all to be able to fight off anything? To me, it's like a catch-22. You give them the booster, so you say they don't catch COVID, but they still are at risk to catch COVID, and they still going to have the ability to fight off the COVID disease if they catch it. So there's no guarantee when I give my 5-year-old, my 10-year-old baby this vaccination that they're not going to get the COVID, not going to get COVID. So for me personally, I'd rather have my child try to build up their own immune system, keep giving them everything that I'm taking, okay, that they've been given long before COVID even hit, and let them build their immune system that way. Let them learn how to fight off a cold. Let them learn how to fight off a germ. When you go into a daycare center, a child's immune system, that's how they build it, by fighting off these different diseases when they're around them. You come home with a snotty nose. Some parents keep their kids home. Other parents send them back to school with a box of tissue, wipe your nose and keep it moving. And I think that that's how they, build their immune system. But I just am not an advocate for my grandchildren getting it. Absolutely not, because I don't feel like it's been tested enough. I don't feel like, and even for the adults, I just feel like there's a lot of unanswered questions. And like I said, and I will continue to say it, and State Rep Jack, guess what? I ain't had no shot since I was 10, and I won't be getting none. Here, I love you.
So let me just interject. I think your point is very well taken, and let me first just acknowledge. You're right. I mean, I agree. Obviously, as a nurse, I do think that you should have right to make those medical decisions for yourself. That's what autonomy is about. However, the only comment that I will say is understanding, and Dr. K, definitely, I'm sure, please come behind me. Immunity for certain things, you can't build that up, so to speak, right? Because if your body, the immunity comes for either having exposure to it, and then your body is able to develop those antibodies. And so they're able to resist that. And you don't necessarily become as ill as you possibly can be. So just because you can't become immune from something that you've never been in contact with. So just make sure that that's a really clear, and Dr. K, that's her wheelhouse. That's what she does. So that's kind of a little misconception. I just want to make sure we clear up too. Hence measles, mumps, rubella, polio, all the other things that kids have to get vaccinated from, because those are communicable diseases that can literally take you out. So it's completely different than having a cold. It's completely different from having a normal flu. So I completely acknowledge and defer to your personal choices, but I'm just saying it's completely different based upon what type of disease process that you're with. No different. I have a friend right now who has breast cancer. She made a choice that she is not getting chemo. She doesn't want radiation, and she's doing it the natural way. That's fine. We'll see what that looks like. We'll see her progression, and that is absolutely her choice. However, there's millions of other women who said, give me the chemo, give me the surgery, give me the radiation so I can eradicate those cells, because there is no immunity for breast cancer. Like that doesn't happen. So I just want to make sure that we're clear as it relates to when you're talking about building immunity, and kids, quite frankly, have the most resilient immune system because of exactly what you just said. My heart used to stop when my son, I only have one child, and I would see him slobbering on the toy, and then the other kid comes slobbering on the toy, and I'm like, oh my God. But my son at 15, by the grace of God, he had one bad cold, but that was because it was the cold. It was, whatever he had a runny nose. That type of immunity is completely different from the impact of what we've seen for COVID. And all I can say and share as a nurse, this is not even just like a regular cold or flu. I have personally, with my own two eyes, seen people on ventilators. I've seen them suction stuff out of their lungs that I have never in my life seen before. And I am an open heart cardiac ICU nurse, and I used to suction people with their trach. So all I can say to people is that this is not just a normal cold or flu. So I just want to put that out there with my own.
No, I understand.
And I've stood there and watched people, more than one, literally die from COVID-19. So that's
I've had family members who have died from COVID-19 as well, personally, close family members who have died.
But if I may, I'm talking about seeing what they go through, listening with my stethoscope, listening to their lungs, and seeing their transition from today I'm talking and literally watching, what happens. So I think, to your point, that's your right. That's your choice. And as it relates to kids, I would just simply state that the concern, in my humble opinion, and I'm a mom, and yes, I'm a nurse, and yes, my son is vaccinated. I'm not really worried if the kids got vaccinated or not. Yes, some of the kids have died. Yes, there are some kids who get really sick based on their own past medical history. I'm worried about the kid that comes home to mom, dad, grandma, or whoever else who has a weakened immune system. That's the issue. Because to your point, even if you have a very healthy kid who has a bad cold or a bad flu, you don't want that kid to go around your 70, 80-year-old grandma, because that's going to knock her out. So it's completely different. So I'll defer to my colleague, Dr. K.
So very interesting conversation. And Georgia's a little different, Meaty, because, you know, our vaccination rates just got to like maybe 50%, if that. So the rollout for kids has been very slow. Georgia has a high percentage of anti-vaxxers. And so we struggled just with regular, like, you know, childhood vaccines. So we just kind of knew that the COVID pediatric vaccine would have a slow uptake. I am fielding questions all the time from people who ask about the clinical trials. There were only about 2,300 kids total in the clinical trial. So that even parents that are vaccinated, that was a drawback for them, for their kids being that young, as young as 5, with just the sheer small number of kids that were involved in the clinical trial. So it's different here. Just kind of looking at the numbers across. So some of the states that kind of have those high anti-vax populations, the states, I think, received information like about a month before they knew that the vaccines, the pediatric vaccines, will be coming out. So they had time to prepare. They had time to prepare, you know, the pediatricians' offices and all of that, but it's just not there. A lot of parents, just in some of the pediatric surveys, have said that their kids, you know, have had COVID and they persevered. So they figured that they would just kind of wait on the next iteration of the vaccine. So that's where we are.
And to that point, Dr. K, what I would say though, if that kid, and this is just my personal opinion, if I'm in a room with 10 people and everybody else is vaccinated, and that one kid or that one person is not, I just hope they put on their mask. You know what I mean? Yeah. So for me, I just feel it's almost, and we've used this analogy multiple times, it's kind of like, we're all adults here, but you know, it's kind of like having sex and the condom is on the counter, but you don't use it. Right. So for me, that person is more at risk for bringing some, you know what I mean? They're not as protected.
And we know that kids bring everything home anyway. So exactly. I think a lot of the message that has been lost in a lot of this, because I got a question, I was on a panel. And so the guy asked, he was like, well, you keep talking about vaccines, but what about the other things? No one's still telling me to wear my mask. No one is still telling me to social distance or, you know, to have the frequent hand washing. But it's like I shared with him, I was like, well, if you're going to be vaccinated, you still have to continue to do all of those things. We know that there are breakthrough infections, even if vaccinated. So if you really want to have a true sense of like high mitigation efforts, then you're still going to have to wear your mask. I still move like it's March 2020 and people look at me. I went into a restaurant to pick up food and the young lady was like, oh, we don't require a mask. And I was like, okay. And I, you know, gave her my name. Right. And so she's like, but you can take your mask off. I was like, oh, I heard you. I was like, so I'm here to pick up, you know. And so then she acted like she couldn't hear me. Can you take your mask off so I can hear? I was like, where's your manager? Did you hear that?
yeah, that part right there.
That part.
You know, and because they try to, because we still have like, the people who are just adamant about not being vaccinated, and then we have those who are adamant about not wearing a mask. And
to my point, Kay, Dr. K, it's like, I just feel like in that context, she heard you. So like my sister here, she chose not to get vaccinated. That's cool. Like, I'm not gonna, I mean, that's your right. So I'm going to wear a mask if I'm around you. What's the big deal? And I don't think that's we now have moved from the scientific medical clinical issue to now, oh, well, it's my right, it's my privilege, oh, it's this, it's that, where it's still a matter of public health. And as a nurse, I'm still telling you that, yes, people are still getting COVID. Yes, people are still dying. We're already come to DC and you'll see the 700,000 flags that are representative of all the people who lost their lives. And all of us know someone who passed away from COVID. So at this point, don't hate on me, and I'm not going to hate on you. I will just choose to govern myself accordingly. And I would hope you two do the same. And I just think, that's now it becomes this clash of, principles. She heard you. That doesn't mean that you have to take your mask off, because what if you were a person who had leukemia and you wanted to protect yourself? You should. Right. If a person has really low white blood cell count and they're neutropenic, and neutropenic means your white blood cell count is so low that you can't fight off anything. And it means you do have a weakened immune system. So just the basic common cold or touching a desk and rubbing your nose can literally kill you. So yes, those people should and do wear masks. So that's just not appropriate for me. And that's kind of where I do, as a healthcare provider, get irritated with the anti-vax, whatever you want, anti-wearing a mask folks, because don't then say I can't wear a mask. No different than Captain Jackson didn't realize I have freckles. I can't take them off. It is what it is. You can't tell me to take off my necklace because I'm a Christian, because I walked into your establishment. So if I want to wear a mask and I'm articulate and my volume is enough where you can hear me, just get my food.
Right.
At the end of the day,
that should have anything to do with it.
Exactly.
Because
I did want to say, we also had, we just had a delivery. I heard somebody mention the at-home testing equipment. We had a delivery to my school. So the nurses who aren't really nurses.
What does that mean?
Wait,
what does that mean?
That means I'm the backup nurse and I don't have no nurses.
So you give out the ginger ale and crackers?
Are these people who have a RN behind their name and they've taken the N?
No, Doc, listen, Meaty, no, they don't. No schools have RNs. We all have clinic assistants, and I am like the backup clinic assistant.
Are you serious?
Yeah. So I don't know if they do that in DC, but here in Georgia,
no, we actually have nurses. They have registered nurse school nurses.
Oh, no.
Yeah.
No. Oh, okay. I'm sorry.
We have clinic assistants and we get training, and the training for me, because this is my second year, has been virtual. You know what I mean? So
which is not really the same.
Stuff, but I am not an RN. I got to know if the baby come in and needed a diabetic needle, how to do all that. Baby, no. But I'm just saying, we, aside from all that, we just got some testers delivered to our school, and we suppose that if somebody
had symptoms,
if a parent, if a teacher or a student, exhibits those symptoms, we now have the liberty to test them. I mean, I'm not, because I don't know what I would be doing, but we do have those on site now where you can be tested at the school.
And if I can say, that presents a problem in and of itself, right, Dr. K, because that's where you then end up with these false positives or false negative results. Because just because I touched the nares is the inside of, I'm sorry, it's like, is the inside of your nostrils. You need to go look like, so if the person doesn't really do it, oh, I'm negative. Well, you didn't even go high enough to get any part of the mucosa to test. Right. And so I don't know what to say about that, but
I was shocked. I was like, when you delivered them, I said,
for not ensuring, not that lay people can't, but they need to be trained on how to do it the appropriate way.
Well, because I don't know, unless they're giving them training. I haven't taken the training on how to.
Because when COVID first happened back February, March, April of 2020, only people who were doing it were physicians and respiratory therapists. Even nurses weren't doing it. Because you have to go so far up into your nasal passage, your nasal pharyngeal area. The thing was about this long, and it was
about this long. It's about this long right here. It's about this long. They had to run that juggle.
Captain Jackson, it was not. Okay, all you are watching. If you are watching, do not listen to Captain Eric Jackson.
Right.
It was not that long.
Everybody.
He's going to say, go get tested. It is just a joke. For all of our OPOV family, don't listen to him. It is not that long. Jesus. However, it was about the size of a pencil or a pen, and it went really far up. So now you don't have to go that far up. But the point is that it's unfortunate that the point.
That's why I'm scared.
But they do have the one with the saliva.
The swab, is the swab one still out there?
I like that one better.
You can still do saliva.
You can do the saliva.
Correct.
But a lot of
But
places.
for them, but I'm
Georgia
saying they're
don't
doing a
offer the
disservice.
saliva.
They're doing a disservice to you and your students and the faculty and staff by not ensuring those of you who are supposed to be doing it as a clinical assistant or whatever they call you, that without having given you proper training. So my humble opinion for anybody else who is watching as well, say to them, we still need adequate training to make sure
Yeah.
that we are testing properly. So.
Yeah.
Then too, what happens if a child does test positive? So do you have isolation rooms? Like,
Yes.
Right.
We do. We have isolation rooms, even if it doesn't test, but if a child comes and basically maybe has the symptoms of COVID, we're supposed to take them to the isolation room, stay with them there, contact the parent. There's a list of things that we have to do in that case as well. But I do believe all the schools now have what is called an isolation room in their building.
and so are they getting like confirmatory testing? Like I as an epi, I'm like, I don't understand.
Well, no, I mean, once we send them home, there is a process. Like you have to go, once you go home, you have to be
For the contract
tested.
tracing?
Yes, they doing all that. If you were in that class, if that was your teacher, you get the letter, the students in your class get the letter, so forth and so on. I mean, that is all in place. But what I'm saying is, as far as the testing equipment coming in and they calling, Ms. Abraham, we have a student in, excuse me, y'all better call somebody else because it won't be me, because I don't know what I'm doing and I'm scared myself, and I'm scared to even do that to somebody. If you got a cut on your finger, if you need a Band-Aid or a sanitary napkin, or you need, that easy stuff, I'm good. But don't bring me nobody. And then they got to do the EpiPen, and you got to know all of that. Like for real. So you got to know the child's medical history. You got to open the book, and then you got to log it. It's like major, and I don't understand why we don't just have, like Meady said, real RNs, like nurses who actually work in our schools and do that.
It's already a shortage already.
I know. I was like, they're not.
And look, there's a shortage of nurses in the hospital, so I'm definitely sure there's going to be a shortage of school nurses.
Oh yeah, we have school nurses who, they have what is called now substitute nurses, because we have a shortage on school nurses.
Oh man.
There's my cousin in California. I won't say who she works for, but I talked with her today on a separate issue, and she's a nursing supervisor, and she told me they've got a 40% nursing shortage.
Yeah, that's true for many facilities. So some units are a little more challenging than others, like certain ICUs, I know have a 50% vacancy rate. It's hard. It's very difficult and challenging, the pandemic. So again, no pressure, no resistance, but just sharing the facts that nurses have, and there's moral, ethical dilemmas right now, because there's people who still come into the hospital who chose not to get vaccinated, but then they end up on the ventilator, and then they need the anticlonal antibodies, and then they need to be turned prone, and then they are very challenging patients to take care of when they get to that point. So then some of the nurses are like, well, why should I even take care of you when you wouldn't even get vaccinated? So it's kind of one of those things of, it's one of those things also when you are, it's almost like knowing that you're taking care of the person who just shot and killed 10 other people, and now that person comes in and you have to care for the person who perpetrated the crime, so to speak. And so there's been I've heard even personally nurses who worked in the ICU who were like, I don't care, why should we have to take care of these people? Well, don't forget the oath that we take. Don't forget our professional responsibility. Don't forget that we still have to. And then, like I said, nurses are leaving because other areas, particularly rural areas that have very, very challenging staffing needs, they are paying, upwards the $3,000, $4,000, sometimes $6,000, $7,000 a week because they have literally no nurses.
What about the nurses, Meady? What do you think about the nurses who are losing their jobs because they won't get vaccinated? Because I think that's sad too. The women who've been doing this 20 years, 25 years, caring for people all their entire lives. They went to school, you know what I mean? And because they won't get
again, this is my personal opinion. Again, I want to be clear, disclaimer, Meady Barnelli's personal opinion. We get vaccinated for everything else. You have to get tested for tetanus. You have to get your flu shot. I mean, and as it relates to people saying that it hasn't been tested enough, really go back and read the science, really go back and understand what warp speed meant, really go back. And the best person I heard give an analogy is like, for example, sometimes it could take a year to build a home, right? Or 10 months or however long it takes to build a home from the basement up. Well, right. If you only have 5 people building the home, yeah, it's going to take 10 months. But what happens if you literally had 50, 60 people building one house? You could build a house in 2 weeks if you had that many people working, right? So once the foundation was solidified and the cement was poured and you have a good basement foundation, if you had 100 people building one house, that house can be built overnight, not literally, but you get my point. And so that's the people have to understand what Operation Warp Speed is. Again, having talked to Dr. Absalon, who was one of the persons who worked from Pfizer, who's a sorority sister. No, I'm just telling you, having talked to her, been on a panel with her and asking her, and Dr. K can speak to it, the technology for this type of vaccine is not new. The technology for this vaccine is not new. No different than when people thought having a Tesla, an electric car, was like, oh my God, they've been working on electric cars for years. Now it's just kind of more of a thing. Now you see more of the Teslas all over the place. Now you see more electric cars. They were talking about electric cars back when I was in high school. So they've been working on the technology. So I just want people to not say, oh, it hasn't been done enough. So what the government did is the same analogy that I used about building the house. They said, listen, cease and assist on all these other things because 500, half of New York City is dead right now. So we need you all to find out what's going on. So if all of us turned our attention to that one project, then that's how you can get it done expeditiously. And once you had 50, 60,000 people and you weigh the risk and the benefits, then you can make an informed decision and say, okay, I had young people, old people, Black people, white people, pregnant people, not like, once you wrote people who got pregnant, rather, you think the people didn't have sex during those times. So, oh, wow, I'm pregnant. Oh, I was vaccinated. All those people who were in those control and variable groups were there. And so when people say that, and even when I first came on with Dr. K, I'll be the first one to tell you too, dear, I was like, a little too quick for me. 45 was in the White House. I'm not sure. Is this a conspiracy theory because he wants to get I was with you, but then I'm like, okay, Meady, you're a scientist, you're a nurse, evidence-based practice. Go back and read some of this stuff. And having met people who looked like me, who, yes, you consider it blind trust. I don't know them, like we're not BFFs, but once she said, like, I believe what Dr. K said, she has a PhD in this. This is what she does for a living. She has no skin she has no skin in the game other than tell me scientifically what she has gone to school for. So when I'm on the panel with Dr. Absalon from Pfizer, and she's like, yes, we've been working on this type of mRNA vaccination process for this amount of time to have developed protein recognition. Okay, cool. I get it. It wasn't just because 45 was in the White House. So for me, I'm going to make that.
No, it was just cease and assist and drop this COVID-19 on the earth, and then now cease and assist. Let's fix it. Okay,
what people remember him saying is like, if you don't get this thing done, you're getting fired. And all of a sudden, this thing popped up. People still remember that.
Well, the reason for that, though, be clear though, I want people to know where I work. This has nothing to do with COVID. You also will not be employed if you don't get the flu shot. You have to go through the same process. Either you get a religious exemption or you have to have a medical exemption. If you don't have the flu shot, you will be fired.
Now, is that something?
Hear me. That has been since I've been a nurse.
So yeah, hospitals.
Most hospitals.
Healthcare facilities.
Most healthcare facilities that are worth 2 grains of their salt. Okay. If you are not vaccinated, if you don't have the flu shot, so this is way before we even knew what COVID SARS was. Okay. I always had to get the flu shot since I've been a nurse, nearly 20 years. It is not optional.
That's something specific to the profession, because me as a firefighter and other police officers and countless other positions, the flu has never been mandatory. It's always been.
So that's why I'm
Type 1.
think about, I work in such a high risk area, right?
Mhm.
So that's the whole point. And people forget 20 to 40,000 people die a year from the flu. We've just
Right.
become immune to
About that.
60,000, 40,000 people dying a year. And hopefully, prayerfully, COVID will be the same way, that we're going to not see 700,000 people in 1 year. So,
Right.
you know, I just want you all to know that, yes, as a nurse, I had to always, and you will, yes, lose your job and become, it is a mandatory requirement for employment unless you go through the same thing, unless you have a medical exemption or a documented religious exemption, then fine. And it's, and what they do for those people, you have to wear a mask.
Right.
So if I know Dr. K or Jackie works for me, I will then get notified, Dr. K or Jackie have an exemption. Guess what? Before we knew what COVID was, they have to wear a mask from November 1st all the way till March 31st.
And,
Even
you
with
know,
the flu meeting? With
Yes,
the flu?
ma'am. If you do not get the flu shot, you are required to therefore wear a mask before COVID. That is the normal process. If you have a religious exemption and or a medical exemption, why? Because it is so highly transmissible. It is transmitted through airborne droplet precautions. You have to wear a mask.
And I've always wondered about that. How come there were, and I realized the numbers, the sheer numbers of the number of deaths and so forth that have occurred by way of COVID, but just how come that same sort of mandate wasn't pushed as tough as, you know, for the flu? I mean, because folks are dying from that too.
Well, because of numbers, because it is sheer numbers. I mean, think how many people die a year from car accidents, but we still drive.
Mhm.
Right? How many people are still getting diabetes, but there's still Coca-Cola machines in schools, all the schools haven't banned it. So basically it's high risk, you know, high risk and your mortality, morbidity.
Yeah, cases of the ratio of cases to mortality. And if it's below, it's like 50%, like people die from the flu, but about.
And also having a cure too, Dr. K, correct? So for example, yes, if you get the flu and if it's that bad, most people can go and there's antibiotics and there's already things that are quote unquote curative. Whereas COVID, there's nothing that's going to cure you from COVID. Even getting the antibodies isn't going to cure you. All it does is manages your symptoms and helps to prevent death and more severe disease. It is not curing you of anything. Be crystal clear. If you get pneumonia, you can take penicillin and you can kill the pneumonia in your lungs. You can't take penicillin and kill COVID. That's the other thing too. So it's the transmissibility, the number of people, the mortality of that specific disease, and if there is a cure or not for it. So sure, if I get the flu or whatever, yes, there's antibiotics and stuff out there that will help to mitigate that and hopefully, again, cure you. That's why you have to get the flu shot every 10 years as well. If you don't have the flu shot, then, because if you get the flu, you could take antibiotics for the flu. And the likelihood of most people aren't being prone and doing all this other stuff that we're doing in the ICUs to try to save the lives of those patients who have gotten severe disease from COVID.
So maybe
did you say flu shot every 10 years?
Pneumonia.
Okay, yeah, because I think you said flu shot every 10
years.
I'm
sorry. The flu is yearly. The pneumonia is, is it 5 or 10?
5 years for pneumonia.
5. I apologize. 5.
I'm not a nurse, I'm sorry.
No. You're right. I got my numbers mixed up. So the flu,
but I did check
the flu is yearly. Your pneumonia shot is every 5 years. You should get basically a booster for your pneumonia vaccine.
So Meady, speaking of boosters, you said that speaking of boosters, you said that you just recently got your COVID booster along with your flu shot at the same time. So for individuals who are fully vaccinated, how long after they've received that second dose are they going? So 6 months afterwards they receive
for Pfizer. For
Pfizer. Okay. And then once they've received that booster, is this going to be every 6 months going forward? Is this like a flu shot type thing where it's going to be just continuous? They don't know that yet.
Dr. K might have more intel than I have. I'm not sure.
Okay. Dr. K, do you have any insight?
So essentially,
before Dr. K speaks, Meady, I know you have another engagement you have to go to. So we want to thank you for joining us. Sorry you couldn't stay for the whole show.
Oh.
But I mean, I wanted to make sure we got you off on time, okay?
I just want to say thank you, Jackie, for allowing to have such an amazing platform, and thank you, Dr. I'm promoting you, Captain Jackson. Thank you, Captain Jackson, for always being here, and to my HU sister, Dr. K. It's always a pleasure. So much love to you guys, and all I can say is be informed. My last, make an informed decision and follow suit accordingly. COVID is still there. So if you choose not to get vaccinated, please make sure you're still wearing your mask and not going into large crowds, and you're washing your hands and you're kind of socially distancing yourself. Because that I think is what's really key. No hate, no shade, no pressure. Just still make sure that you are taking care of yourself and being very, very, very diligent about that. And at the end of the day, be health empowered. So much love. Have a good one, you guys.
Thank
Love
you,
you.
Dee. Have a great night.
And speaking of which is very interesting, as Meady was saying, you know, if we look at the football games, the baseball games,
Parade.
who's vaccinated?
30-second
Who's
parade.
masked?
There are no requirements.
I mean,
They're not
it's just
required.
crazy.
No.
That's a state thing, I know.
Yeah.
No,
Like
and the thing
UGA,
is,
none of
it
they
makes
all,
money. When it come to money, I don't care. Y'all can say what y'all want about me. I'm the advocate of the right, left, right, whatever. But I'm telling y'all, as long as it's making this government, this country money, you ain't heard nobody say nothing about, you ain't heard one complaint about nobody not being masked for that Braves game, all these big football games going on, these college games going on, crowd 60, 80,000 people in one setting, sitting close together. But you ain't heard nothing about
Look,
COVID.
Connie, there's a game.
and I will tell y'all, oh, go ahead.
I was just real quickly, there's a game that was going to be played by one of the collegiate teams that's going to have to postpone it because there's an outbreak on the team. So it's still out there, obviously.
But that's what people don't understand. And so I've been talking about this a little bit more, like it kind of died down. I guess I got fatigued from talking about it, but
Right.
and just like Meady said, like the mRNA, like quote unquote technology has been around, but it was so expensive. So 45 just dropped all this money into the development, right?
Right.
So y'all remember AstraZeneca?
Yes.
Paid money. Is it available in the US?
I hadn't even
I
heard
don't know.
anything
I
about
heard
it.
of it.
But they were supposed to go through FDA, EUA authorization around the same time as J&J.
Right.
But they could never get a stable formulation enough to pass FDA. Now they're in other countries. So what did the US do? The US like, well, oh, we'll lend our doses to Mexico and Canada. So that's where AstraZeneca went. Have y'all heard of Novavax?
Yes.
Oh.
So Novavax is another vaccine that was supposed to come into the market. They gave money to a lot of the medical schools at HBCUs. And they said that their vaccine would not have to be refrigerated. So they were like, oh, just think of, what this could do for developing countries. No approval. And the US dropped about almost $1 billion to help them develop it.
So
we
Doc,
can't
what
get our
about
kids a free education in college. I can't. Please don't tell me that. This is why I don't come on these shows like this, because I get.
So Doc, the vaccine, going back to what we were talking about with the children, is that vaccine for the 5-year-olds and up and what have you, is that is it under EUA authorization, or is it full-fledged?
No, it's EUA. Pfizer is the only vaccine that has received full FDA approval, and that's for 16 and up. So the adolescent version, the 12 to 15 is still EUA, and the 5 to 11 is still EUA.
So here's my question with this, and it's just merely a question. For them, for the medical community, scientists and so forth, to have worked on this for so long, what is it surprising that they haven't come up with a more with a solid concrete type of thing. I know technology and medicine and science changes, but it seems as though they should be out of the EUA realm since they've been working on it for so long.
Data.
Ma'am.
They're still collecting data. So Pfizer had enough data collected because they started like kind of first.
Okay.
So they had enough data to present to the FDA, not for the 15 and under, just 16 and above. So FDA was like, fine. But I think Moderna and Johnson & Johnson, they're getting ready to submit a package. They said before now for approval, don't know what the holdup for that is. But the tech, and I just want to just clear up what was said. mRNA technology existed, but not for vaccines. And that's where people, it just kind of takes me left and I don't say anything. It was used for therapeutics, not for vaccines. So has there ever been an mRNA vaccine in the works? No.
And see, Dr. K, that right there.
Yeah.
That's what happens to us. They give us a snippet. You put a little bit out there, but you don't tell us the whole thing. You know what I mean? So now you leave me with mRNA been tested over gobs of years, but was it for the vaccine? Dr. K said, no, it has not been. So then tell me the whole entire, say it was tested for this specific thing. Don't leave me out there to make me believe that it was tested for this and it wasn't.
Y'all know me. I'm just going to tell the truth. But that's what it was. So because people were like, oh, it's new. And there's like, so that's why they say, oh, the technology isn't new.
Right. Let's be clear and let's say that.
And I get the technology is not new, but like you said, as far as vaccines go, it's a totally different, that's a different subject.
For a vaccine.
So the Jetsons was driving electric cars back when I was a little girl. So we knew electric cars was going to make its way for real in the world because they did it on the Jetsons. However, they wasn't driving Teslas back when the Jetsons were, come on, y'all.
Now the Jetsons cars were flying.
Yeah, they were
They
flying.
weren't electric, they were flying.
The Jetsons.
You know what? I think those look, check this out. I think those cars that the Jetsons were flying, and I heard this too, makes sense. Those represent folks having private jets. Because that's what he's in. He's in a little private jet.
And it's called the Jetsons.
That's true.
That's so deep.
That's a good point.
But
But to your point, the cars can't drive themselves though. Once they were on when they like landed, like they parked and everything. So they
right, they did,
So
Dr. K. They
that's
did.
Yeah.
I'm just saying.
I'm just saying.
She said,
Things that
So
make you
now-
go,
So so let's talk about travel really quick.
Mhm.
Because that's my industry. I'm in the travel industry. So my company sent out an update letting us know that starting at the end of November, in order to travel outside of Canada, you will be required to be fully vaccinated. So for any of our crew members or any other airline's crew member that's not vaccinated, you will no longer be able to travel to Canada. You won't be able to work any flights. So as we know, the U.S. just recently opened our borders to international countries that have been banned since basically, the beginning of this pandemic. Dr. K, are you guys having any concerns about this wave of new people that are going to be coming in to the country now that there's 33 new countries that are no longer on this ban list?
So what's going to happen, and no one talks about the variant that's coming out of South Africa. There's another one because Africa now is only, as a continent, it's only about 3% vaccinated. So, and then there's a variant that's of Delta. So Delta was almost its own different virus because of the number of mutations.
Right.
We know that the Wuhan strain, which is the original strain, is no longer in circulation.
So that's gone.
So that's gone, which is why.
How did it get gone? Through the vaccine?
No. It just automatically it leaves the population because of the other mutations. So no one was like really, so it was a kind of like a weaker variation. if you will. So the initial strain is no longer in circulation. It probably still exists in maybe some of the remote parts of the world that hasn't really had like a lot of people.
Mm-hmm.
But here in the US and most other, quote unquote developed countries, it's no longer the dominant strain in the population. Delta is. And then now we have like another form of Delta in the UK that's a little bit worse than this current strain. And so what data shows us is that we're about, because the UK was about 3 or 4 weeks ahead of us in like their COVID plight, I'll say. So their numbers are increasing. And so now, we're going to start to see that the same thing. It's UK, then it hits the US because people are still traveling.
Right.
And so to tie that back to the boosters, I'm like, that's why the companies didn't do boosters for the entire population, because those mRNA vaccines were built on the original strain.
So the boosters that
Get
folks are
Meaty
getting
back
now,
on the line. Call Meaty. I mean,
so
So,
the boosters that folks are receiving now is based on the old or the current?
They haven't updated any formulation. So to do that, they would have to go back through the FDA.
But it's the same vaccination that we've already taken. It's just you're taking it again. So it's going to be a third shot of the same medication.
Pfizer put out a paper and said data that their vaccine weakens over time. So it's like 20% every 2 months. So that's why they're saying 6 months, there's pretty much little to no protection, which is why if you are really, so you have some resistance to it, but if you are in that elderly group or immunocompromised
Right.
group, then you really need to get another dose of this. Just so it's sort of like going to the gas station when your hand is on like a quarter of a tank.
Right.
Just enough to get it to like maybe right between quarter and a half.
Put $5 on it.
And so essentially that's what's happening. And then once they get enough data, they'll probably submit.
please, Dr. K.
So,
please.
I'm sorry. So, Dr. K, you're saying that the UK and Africa both currently have strains that are worse than what we have here in the US. And now that they've opened the borders to, even though the people who are coming over are required to be vaccinated and have negative tests, they still can bring that strain into the US.
Asymptomatic people, we don't talk about any of the stuff we
Right.
talked about in the beginning. Being asymptomatic, that you can still be vaccinated and like and get COVID. It just depends where you are in your infection.
And that's the other thing I was going to ask you too. Weren't there some studies that also show that people obviously who were vaccinated could still get it and spread it, but for them personally, it would just help lessen them having to be on an event or having to have an extended hospital stay. But doesn't mean they couldn't necessarily go.
Right. So I mean, we look at Fred Blankenship.
Right. Yeah.
Fred Blankenship, family fully vaccinated. They went to California.
Yep.
They were doing, a whole family got sick with COVID. He got sick to the point where he had to be hospitalized. He said he had it bad. So it does not, and then we have to think about these vaccines aren't 100%. So you're still going to have at least 10% of the population, even if they're vaccinated, to get a severe form of the virus.
Right.
So let me ask you something, Dr. K. So what is it now? Because I don't know if you heard it, so just give me clarity. You can get, because initially when it came out, they were telling you to get one. If you get Pfizer, get all Pfizer. If you get Moderna, get all Moderna. Now you can get Pfizer, Moderna, and
Wait, what?
So
you can get Pfizer for your first dose, Moderna for your second, and go on and get the J&J booster. I'm just saying.
So they were saying for the booster, you can they're mix and matching boosters.
You mix them.
because essentially it's not in your system anymore. Think about it.
Wow.
I can't. I'm going. Thank you for joining us.
Look,
Well,
look,
you know what, guys? We got 1 minute, so
Look,
we got
Dr.
1
K,
minute. The show is over. We can't even.
Dr. K, check this out. So I just read something too, where now they're saying, encouraging people to get their vaccine shot for hepatitis B. Where'd that come from?
You only need that
That's another show.
if you're working in hospitals or in with, animals or clinic setting. It's not for the general public.
Okay. I saw that, read that, but I guess it was.
Essentially, and this is Johnson & Johnson jumped on the bandwagon too, because Johnson & Johnson really didn't even need a booster. But they were like, everybody else making extra money, I'm gonna make extra money too.
He's preaching.
And that's why the borders are
Almighty
open.
dollar.
Extra money. That's tourism. That's
Well, guys, we're gonna have to end this. Right
No, we're not ending
No,
it.
no, we're
staying
not
right
doing
here.
But no, seriously though,
I'm outnumbered. Go ahead.
the vaccine, so if you're losing 20% efficacy every 2 months, after 6 months, it's pretty much
over 100%.
So that's why they're saying if you get a booster, it doesn't matter because you pretty much, the other one is out of your system. When you go get a flu shot every year, you don't get the same one.
Yeah.
You get whatever that doctor's office has. They're not tracking that because it leaves your system. It's not in your system anymore.
Knowledge is
Yeah,
power.
right.
No, knowledge is power. That's all
Yeah.
I'm gonna
Oh,
say
yeah.
to our
That it
viewers.
is.
I'm not, y'all know I'm just
I appreciate you, Dr. K. But
Yeah.
I'm saying to our
Mhm.
viewers, knowledge is power. Just
Mhm.
research, y'all. Read, listen to the different conversations that are being had, because this stuff is what we don't know. You know what I
Mhm.
mean? And we don't know it because nobody's really having these kind of conversations and keeping us informed. So that is why we are here, our Point of View talk show. As Jackie wants to do these updates on COVID, she's right though, because I
Have
learn something
to.
every
You have
time. No,
to.
for real.
Yeah.
And I joke a lot about I don't want to do them because I feel like that's a whole nother show. But I do learn a lot every time we have these conversations because it's stuff that people are not sharing. You know what I mean? So we get it
Yeah.
here from Dr. K and Meaty, but we don't get it just out in the plug. But we don't know that. No, I guarantee you, everybody that I know that has been vaccinated does not know that 20% of that, like that every 2 months you're losing it. So that's why you got to go back. You got to go back and get another one. And they trying to give you that second shot in time so that by the time that first one wear off, you got that second one. So you telling me every 6 months I'm gonna have to be vaccinated? Come on. If that's the case, then tell the people that, so that they are clear and they understand, because you got people out here thinking that they took the shot and then they did both doses, then they got the booster. So they thinking, okay, not saying that they got free, but they good. They thinking they good. You know what I mean? I'll put my mask on, but I'm good. No, you not good.
right.
You still got to do what you got to do.
Doses wore off and you only got 1 dose of a booster.
So Dr. K, okay, I was just want to make sure I'm understanding this. So you said, stop laughing.
You
You said that the original strain for which the vaccine was formulated is no longer in circulation. So what are we being vaccinated against when we get the original vaccination? Like when you first go to get.
So you're being vaccinated against COVID. It's just the original strain, and it's not based on any of the variants that have happened after that. That's why, I mean, and this is my point of view, but that's why I was like, Johnson & Johnson is newer and it was developed after the variants started showing up. So they have those newer variants.
So if you're gonna go get one,
get what's new. Always get what's new. Because they
like the pneumonia shot, the pneumonia shot you get once every 5 years. Why can't they do that with the COVID shot? Why can't you do that once every 5 years? Why do you have to get 2 shots and then a booster every 6 months?
We're still in testing.
It's new. It's still new.
Well, like with tetanus, the tetanus shot, you get that every 10 years?
10 years, yeah. And pneumonia is 5, yeah.
Yeah. And so again with the booster, because I tell people Pfizer and Moderna are mRNA. Johnson & Johnson is a viral vector. It's a totally different system.
It's
So
a what?
So which one are you thinking is
so
more?
viral vector is the more traditional vaccines that we've seen, like all the childhood vaccines were built from. That's Johnson and Johnson.
Like the MMR.
So that's the one that's most effective?
And all that.
I won't say it's the most effective.
She can't say she's not at liberty to push any of them.
But
However, draw your own conclusion by the information given.
thank you.
Well, I mean, I thought you said Johnson Johnson was newer, so that's the more up-to-date vaccine. So I'm wondering, is the booster more effective if the original vaccine is newer and more effective? So that's the question that I'm asking. But I mean,
But you
don't
can
say
mix the
anything
booster.
You can't say so.
You can mix the booster.
Mix the boosters.
You don't have to get the same booster that you got the regular vaccine with.
No, I know that. I didn't get the Johnson & Johnson vaccine. I don't have that, but I'm just asking as far as her saying that the original Johnson & Johnson vaccine is a newer one because it was developed after the other strands started coming out. Does that mean that their booster has a different
Variants
level or,
because remember we had the UK strain, and then it was South African, and then we had Brazil. So Johnson Johnson kind of came after that. These mRNA vaccines first started like really being developed like February, March, April.
Now, most doctors' offices, they will have what? One particular one, or will they have the options available? Like, how does that work?
The doctors' offices are pushing Pfizer. Everybody's like Pfizer. And I was like, I sat on the call for Pfizer, and I know they took the happy path. And so, and not to contradict Meaty, but when she was like, had all, representation of all these different groups, they didn't. They mainly only had healthy people in their studies, in their trial. Well, that they recruited healthy people. I'll say that they can get sick while they're in there, but their goal wasn't to get these variations of people.
So there was no one in there that knowingly had any major underlying diseases that would,
Most of the time when they recruit you for clinical trials, they don't want you to have it.
Right, that's why they recruit you, because you're going to be a part of their trial. You the test rat. You know what I mean?
Like that's not realistic.
You're a healthy subject.
Because in this country, we know, and I mean, I'm not a doctor by any means, but we know that this country is one of the most unhealthy. So obviously that's not a good representation of the population.
And unless it's for something like when I was in college, I worked for this clinical trials company. And so y'all know, what is it? Excedrin migraine and all that, those different.
Yes.
So they were giving people like $500 to have a migraine. So if I'm already diagnosed migraines, right? So they would have them to come in too. So I was the one taking all the information. They had to answer all these questions. Like, is it on one side or the left side? It's like, okay, you have migraines. So they was like, okay, take this book and take these medicine. Here go your $250 check. So when you have a migraine, you need to answer these questions in this book, take the medicine, answer the questions, and then come back with the book filled out, and we're going to give you your other $250. They were calling their friends, people. They was
oh, my head.
$100 just for coming in, even if they, the friends was like,
right.
Tell them this, it was crazy.
Yeah.
So,
and they do that with studies still now today, all the different studies with the medications and stuff like that. And a lot of young people, they go get blood, they get in for this test, that. Oh, we're giving you $250. They sign up, they get tested, all of that. I mean, it's just very popular. But unfortunately, we don't get the true meat.
But the crazy thing is that Excedrin migraine is nothing more than extra strength. Excedrin, they just repackaged.
Right, and put migraine on it.
So that's careful. Always read labels. Just do a search, not Google. But if you do Google, make sure it goes back to the company's website. So you can see all of that stuff, because people are like, oh no, I can only get a Excedrin. They was like, well, I got you extra strength. They was like, no, it has to be the migraine one. And it's like, honey, it's the same thing. Then said, then they brought out one for tension, because they were like, people want to be given whatever space, like, oh, it's a migraine, so I need migraine. It's a tension headache.
Yeah,
medicine, and it's all the same stuff.
all the same. Yeah.
And, you know, didn't the numbers of STDs go up as well?
Oh my God, yes. Because people were online, like the same thing with the online dating apps skyrocketed. People were hooking up, looking up, doing all kinds of stuff, and then got these STIs, because you know they call them STIs now, and going to the emergency room and taking up space because they're like, it must be COVID because this ain't never happened. I got COVID, and you go in there and this is a STI. And so a lot of the emergency rooms had to put up signs. If you have this, and this, it's not COVID, go to urgent care. You know,
And I don't know, did they keep running these commercials about this medication and PrEP and
HIV because
yes, on every Hulu show.
They're like, oh yeah, PrEP, that'll protect you. So people out here just wilding out, and then but they don't. But then for STIs, like, well, no, they don't want to do COVID contact tracing because they was like, well, I don't want to tell you where I've been for the past, 2 weeks or whatever. But then you tell me like, oh, well, you have an STI and COVID, so you. Now you got to contact people.
Oh my gosh, this is just crazy. Wow.
I had the contact trace for TB. I've worked on y'all remember that homeless shelter that was like on Cortland? It was like a high building.
Yes.
So well now it's like condos or something, they ran the homeless.
Yes.
But that's a story for another show.
That's a whole nother right.
So there was a TB outbreak. And so I was working the case. And so we were seeing clusters in like St. Louis, we saw clusters like in Mississippi, and like, basically anywhere that the Greyhound bus went, like some of the main cities. And so what we did was we could sequence the people, the type, to see what particular sequence or specific strains, was able to trace it back. We were in St. Louis, traced it back to the Atlanta shelter because those men there had TB. They were like veterans and everything else. They were at that shelter, and then they would get on the bus to go, with family and stuff into these cities. And so that's how we were able to trace it. Contact tracing has been around, so we had to contact all the people on the bus, all the people in the terminal. That's when if you've ever watched a news show and they're like, if you were at such and such on such and such day during such and such time, call this number because you've been something.
This is I'm getting a migraine now.
Overflow. Information overload.
So I get so frustrated when all these Google public health people out here trying to tell folks, and now everybody expert, doctors, everybody. I'm like, what have you done in public health? Like, what have you done other than treat the people? You are not on the other side of this.
Hey, look, they may have worked at a health fair.
They might have been a substitute clinician at the high school.
They were a candy striper at the hospital. You don't know nothing about that.
A full PAPR, like a full hazmat suit with my PAPR personal, like the Power Air personal respirator breathing for me.
Yeah.
Gloves on, trying to swab people and test them. Cause I'm like, I don't know what this is. It could be monkeypox, because the man that came back from Africa came through Hartsfield and went on to Dallas and had monkeypox. I was like, I know this is what I do for a living. So
monkeypox.
Yeah, it's
wow.
It's a smallpox, but it's still active when you're out there letting animals lick you and all that kind of stuff.
And on that note,
kissing y'all in the
wonderful show.
Thank you. It was great.
Thank you so much for joining us, Dr. K. We really appreciate it.
Thank you,
love
Dr.
your
K. Always
updates.
great information.
And next week, we're going to be talking, Connie's going to have a show on young love, young couples. With that, and just remember, everything you heard and everything we said was our point of view.
Our point of view. Remember that. Read, everybody. Study. Research.
Young love.
Don't let the animals lick on you.
Stop licking on
That's you on the lips.
me.
Thank you, Dr. K. Thank you.
Thank
Thank
you.
you.
Thank you, Meaty.
Thank you, Edie.